Hi, I'm Dr. Janjua. I'm a board certified facial plastic surgeon, and today I will work with Jessica. She's a beautiful teenager who is interested in rhinoplasty, and we want to document the journey of a rhinoplasty. Every year, thousands of teenage girls and boys go through this very common procedure because nose is very important to our facial identity, and it can make a big difference in how we view our face. It is a very challenging procedure as well, so it has to be done precisely and it has to be done with orientation to detail. As we know, the revision rate can be 10 to 20% depending on the studies you look at, so it's a very, very important surgery. And it all comes down to proper diagnosis to make sure that you can deliver the results the patient wants. The other important thing is communication between patient and the surgeon. A lot of times, if there's a breakdown of communication, a surgeon might give a very beautiful nose to the patient, but that's not what the patient wanted. And that's why it's critical to discuss it over and over again ad nauseum, where you're both surgeon and patient on the same page. Having said that, I'm going to quickly ask Jessica to kindly tell us her concerns, and then I'll examine her and then we'll come up with a plan. So Jessica, could you please tell me your concerns, and I'm going to help you with a mirror so you can take a look first from the front and then we'll go to the side as well, and I will give you a Q-tip to point out as we go along.
Okay, I have two bumps coming out of my nose here. I don't like those.
She's pointing to the bump as the Rhinoplasty horns. Those are the bumps that happen from the bones meeting in the midline, and the bifidity that gives the appearance of the Rhinoplasty horns because of the bones. Please continue.
And then when I smile, my nostrils flare out too much.
You can smile big, that's okay.
They flare out a lot, making it look bigger, and then the tip of my nose, it just looks very large.
Got it. So sorry, go ahead.
That's it.
Okay, so she's referring to the nasal alae, which are on the sides, and the alae flare up with smiles, and usually it is a big problem for a lot of African American patients, but even in Caucasians you can have a flare that doesn't look very aesthetically pleasing to some patients, and for that we do alarplasty, where we take a wedge from the sides and place the incision very close to the alar groove so you can't see it, and that narrows the flare by bringing it inwards. Great. Now we'll give you a second mirror so you can visualize your nose from the side. So if you hold and look in that mirror, you might be able to catch that.
There you go.
Great. So now I'm going to I'll hold it for you and you can point out, please. Tell us what you want.
This huge bump.
Okay.
I want that gone. And then once again, my nostrils, they're just very large from the side. And then my tip goes up a lot.
Got it.
So just the same, but on the side.
From the side. Wonderful. Yeah. That's great. Excellent. So as I plan my rhinoplasty, I'm looking at all those areas of concern, and right away we can see the hump. That's very easy to identify. That's mostly boning, and it, as much as seems large to her on close examination, it is not that large, and reducing the hump bones will take care of that. Also, the width of the upper nose is contributing to her impression of a big nose, and when we bring it in with the osteotomies, it'll give it a nice appearance. The width definitely can be addressed. The one area that I had to work very hard to figure out was the nose, whether the tip really is small or it is not, or is it really big. And looking at different angles, it appears that probably is giving the illusion of being big and it's not as big as Jessica thinks. One way I looked at it is if I put her head up a little bit, and then we'll zoom in to look at the nasal tip a little bit more. The tip does not appear to be as big, but the width of the nostrils definitely is. So this area right here does not need too much narrowing, because if you narrow it too much, it can appear a little pinched, and it is not probably a good idea. And push come to shove, if down the road we feel that we do need to narrow it, that can be done as a separate procedure if needed. But the pinched look like this is not necessarily a nice look. Thank you. You can put your chin down. So this completes the evaluation, and at this point it's very important to make sure that all the questions have been answered for the patient, and we will continue to follow Jessica through her recovery and the procedure. So we are following up with our patient through her journey of rhinoplasty to document everything, so this way hopefully it'll help other teenage girls like her who want to know, what am I expecting, where am I going to be? So here we are in the holding area, and she seems pretty happy. Did you take the Xanax that I gave you?
Yeah.
Perfect. So I think that really helps. It takes the edge off. You know, you don't feel anxious. So wonderful. So even tonight, like, you know, when you have pain, along with that, if you feel a little edgy, because the nose is plugged up and stuff, take a Xanax.
Okay.
That really helps calm it down. Makes a big difference. So good. So I'm going to go over the nose quickly. I'm going to take this off for 1 second. So good. So your nose looks big for the face, and we have to make it smaller. That's what we decided. And we are going to narrow the ala, which is the nostril right here. We are going to narrow the tip a little bit, not at the point, but just on the sides here to give it more definition, a little pinched look right there. And then from the side view, we are taking the hump down. That's what we're doing. So your cute little nose, and not a ski slope, but more of a straight nose, because you and I discussed that, you know, ski slope is not for you.
Yeah.
Another thing that I noticed actually was studying your photographs yesterday is that on the side view, this thing called columella, this thing, it kind of like sinks inwards. So I might put a little cartilage graft in there to kind of pull it out. That looks a little prettier that way.
Yeah.
Just a minor detail.
Okay.
So good. Any questions?
No.
Are you ready?
I'm excited.
Perfect. Me too. Excellent. Let's take this show on the road.
All right.
So we are in the recovery room. We just came back from the OR, and I think Jessica is waking up. She's still sleepy, but she is a little bit awake, so she's feeling pretty good. Jessica, how are you feeling, honey? You feel great? Okay. That's nice if you feel great. Listen, everything went excellent. Everything went beautiful and no problem whatsoever. You are going to have a beautiful nose. You're going to be very happy. So good. So good. So how do you feel right now? Do you feel the pain, nausea? No pain, no nausea? Very good. Great. Just a little sleepy, I guess? Good. And got you. No black and blue, so we are good for now. Great. Excellent. You did very well. I'll see you tomorrow morning, okay? You take a nap, honey. Take a nap. We are here following up with our rhinoplasty patient. She's all smiles today on day 1 after surgery. And how was your night? Night was okay?
Yeah.
And how's the pain?
It's not that bad actually.
Good. And nausea or vomiting? None of the stuff. Very good. Great. Excellent. So may I take this off just to take a look underneath, see what you're hiding from us?
Yeah.
Very good. This is just a little drip pad. Let's see. Perfect.
Yeah.
So excellent. So what I'm looking is, you know, I think you got very little bruising, if at all.
Yeah.
So that's looking very good. All I see is just maybe a little bit of crusting around there. So other than that, looks very good. Perfect.
Yeah.
I'm excited.
Too.
Good. So what I want you to do is just start using hydrogen peroxide and Q-tips. You're going to just gently clean around that area and inside the nostrils as well.
Okay.
But don't try to pry open the nostrils, because remember there are stitches here holding them right around the edges, so just be very gentle.
Okay.
And then go back on saline spray. Do you have saline spray at home? Great. So the more you use, the better. It's going to help the inside, because in your case with the surgery, a lot of it on the inside as well. And you might feel like I need to blow my nose because there's so much of old blood and stuff and secretions, but you cannot blow your noses yet. And if you feel like, oh, I gotta do something, then use a lot of saline spray and then gently sniff in. And if it goes back into the throat, you can spit it out.
Okay.
That's less traumatic to the nose than trying to blow the nose, because that increases the pressure and we don't want that.
Yeah.
Also, to help with the swelling, we like to minimize salt intake. So if you're like a potato chips girl or French fries girl, then please just try to cut down on the salt.
Okay.
I promise you got your whole life for salt. Just for the first few weeks or few months, you have to really watch out for it.
Okay.
So after that you can. Obviously no exercise, that increases swelling, and you won't be hanging out in the sun. So those are the few things that increase the swelling, so you have to be careful with.
Okay.
Wonderful, great. So I'm just going to focus a little closer on you just to take a better look and see what we can. Very nice, perfect. I just like the fact that you got very little swelling. I mean, usually when we have to do the osteotomies and break the bones, it's always like black and blue. So
yeah, it's just like a light blue
tiny right there, which is perfect. So I wanted to make sure that keep icing today as well.
Okay.
Perfect, great. Would you mind putting your chin up a tiny bit so we can see
Yeah.
underneath as well? So we can get a good view. Oh, I'm loving it. That's great. Perfect.
This is day 3 of my surgery. The pain in my nose is starting to go away. I can start to breathe out of my nose a little bit, but it's still kind of hard. It's not bleeding, so that's good. And the only pain I have right now is I have a headache just all through here. And then this is starting to bruise a little bit, but other than that, everything is going pretty well, so I'm excited.
We are at post-op day number 5 and our patient is doing great, and fortunately she did not have any bruising, very little bruise, a little bit around the eyes, mostly on this side over here. Other than that, she looks very good, so I think it's time to take the splint off. But how have you been doing since we saw you after the first day after surgery?
Good.
And
Good.
what kind of activities have you been doing at home?
A lot of laying on the couch.
Very good.
The Harry Potter marathon was on, so I watched that.
Very
Yeah.
good. That's great. That's good. How about the icing? Did you do some icing the first couple of days?
I did a lot of icing.
Good, good, good. Okay. And how was the pain over the last few days?
It wasn't that bad.
Wasn't that bad?
Yeah.
Okay. And how was your sleeping?
Fine.
Fine.
Yeah.
And how was the eating?
Eating was fine.
It was
Yeah,
fine too?
Able to eat.
Okay, gotcha. Well, those are the typical questions that people, ask and they want to know. Anything else?
Not really.
Very good. It's pretty simple,
Pretty
straightforward
easy,
then?
yeah.
Excellent. That's great. So it's time to make you comfortable and then take the splint off. That's what we'll do. I'm going to be extra gentle. I want you to rest your head. There you go. Let's put the chair back a tiny bit. And then gently remove it.
I'm excited.
You're excited.
Yes.
Good.
How's it, Mom?
How about you take a look for yourself instead of asking Mom? So there you go.
So little.
Can you see?
Yes. It's so cute. Oh my god, it's like perfect. It is perfect. I love it. Thank you.
You are very welcome. I'm so happy for you. I'm
It's so cute. I want to take pictures of it and send it to all my friends.
Oh my goodness. The days of the selfie. Oh my goodness.
Oh yes.
Very good. Excellent. Great. Yeah, and I'm very happy. It's looking excellent. Good, good, good.
Beautiful.
Oh, wonderful.
Thank
I'm so
you.
thank you. I'm so happy for you. So we are at 2 weeks follow-up, almost like 13 days after surgery, and there's no bruising. She looks very comfortable, and she's got a nice smile because now she has a much smaller
Yeah.
nose than she started with, and she has no complications. She's happy. Nose is a little congested, so I told her to use some more sprays and stuff, but at this point she's looking very good, so I'm going to just have her put the chin up a little so we can see underneath, and I'm going to do a little close-up as well. Perfect. So we can see how nicely the alarplasty incisions are healing as well. You can barely see those. Now you can look down again, please. Thank you. Let's move back a little bit. Perfect. Great. Then I'm going to turn a little this way. Great. So we can see the three-quarter view. Three-quarter view on this side as well. And everything seems pretty good. There's some swelling here. That's very expected. And to help that, sometimes we use a little bit of steroid injection that we'll use today, and have her use a little bit of either taping or splint to keep it in check so it doesn't swell up too much. Otherwise, she's on track to look gorgeous. So we continue following our patient, and now we are at the 1 month mark, and we are looking to make sure there's no excessive swelling or any changes. And it appears to be looking really good. You can see that the tip, is still narrow, and the dorsum has come down as well. The sides are pulled in, and I'm going to show the incisions underneath as well. So you can see even in early phase, the incisions are healing very nicely, and we are at a very good spot. And we'll continue to monitor because there can be a delayed swelling sometimes at around 3 month mark going forward. And if we have to, we'll use some Kenalog at that time. And can you give me a deep breath, please? I want to make sure your nose is working well. Working well? Great. Thank you. So we are at 3 months mark, and the patient is healing very well. She's able to breathe, and her nose looks excellent. There is this little bit of discoloration which could be just from sun exposure and some breakout at times. And at this point, you can see from the frontal view looks perfect. It's small in size. You cannot see any scarring anywhere. And now I'm going to turn her a little to the left side, and you can see a nice profile. As we discussed earlier, she's concerned about the little bit of hump over here. And I explained to her that the rhinion area always looks naturally a little bit raised, but then again, it's a personal preference. Some people like it to be completely flat, and if she wishes that, then we will address it at some point. Now I'm going to turn her even more so you can see from the side view that it looks very nice. Let's do the same on the other side half view, and then completely right there. So the nose looks very appropriate for her face at this time, and she's got a beautiful profile. Excellent, great. Thank you. We'll follow her at 6 month interval, and that's when we will decide if we need to bring down the hump a little bit to make her even happier. So we continue following our patient on her rhinoplasty journey, and she's 6 months from her surgery, and as you can tell, she's very happy. And her nose looks great. She has a new addition right here of the nose ring that we did not plan upon, but that's okay. That's in vogue these days, so it looks good, but she looks very good. So I'm going to just gently turn her a little to the right side, and you can see the 3/4 view, and then I'm going to turn her a little bit more so you can see the lateral view from the right side, and I'm going to gently turn her a little to the 3/4 view on this side, and then completely to this side over here. And as you can see, it looks really fantastic, and she's very happy. She has finished her journey, and I'm very happy for her as well. We continue to follow our patient through her journey of rhinoplasty. She had a very good result, and she wanted to make it even better by reducing the nasal hump at the area of the rhinion even further. We decided to wait till it was 6 months, and then at that point we reduced it using a small in-office procedure, and mostly just using rasps to bring down the rhinion. And now finally her nose is looking excellent. She's very happy with the overall appearance, and as you can see, the nose does not look big, looks very natural, and fits her face very nicely. I'm going to have her turn a little to the right so you can take a 3/4 view, and you can see the profile is excellent, and there's no hump in the area of the rhinion. We'll turn completely to the right, and you can notice the same thing. It really fits her face very nicely. It's important to look from the other sides, other angles as well, because sometimes you can catch a glimpse of a hump or something only from one angle and not the other. So let's turn around towards the right side, halfway, right there. Excellent. And you can see that it looks very appropriate. No sign of any hump, no tip droop or tip elevation, and everything looks very good. And on the side view, finally, you can see same thing again. Great. And that's the end of our journey. And the nose continues to change all through our lives, and it's important to keep an eye. So I like to see my patients at 1 month after surgery, and then once a year if they're willing to come. Very good. I'm going to have a look at the camera and give her a smile before I let her go. Thank you very much for allowing us to use this video, and hopefully it'll help a lot of young teenage girls, because they're always very afraid and apprehensive. So watching something like this is going to make it easier for them. Thank you for watching the video. I hope you liked it. I love doing these videos, and I really enjoy the participation and the comments and everything from everyone, and I will keep putting in more material. And if you like it, please subscribe to our YouTube channel so you can keep watching the new editions as they come along. And also, we are active on social media, so please like us on Facebook and on Instagram, and follow us on Twitter. We will try to provide excellent stuff and keep you all engaged and exciting. Thank you very much for your time, and enjoy.